So we're going to start with the head. How do you guys feel about this stuff?
Terrible.
Bad.
The lecture stuff is pretty much just the stuff he tested on the quiz. The midterm and the final have a lot of repeat questions. If they're not the exact same question, it will just be worded in a different way, but it's still information that you've been tested on already because the whole course is cumulative. So the similar head questions that you guys had on your quiz, it'll be pretty similar on your midterm for lecture stuff. And then for lab, it's just like the main stuff and the main species differences, okay? So if he tagged this right here, what would it be? Yeah, so this is your torus linguae. Okay? For us, he tagged this part right in front of it, right here. There's a little groove. What's that called? So that's your fossa linguae. Okay, so what would this be?
Hard palate?
Yeah, so this is your hard palate.
Yep.
What about right here? Soft palate. This part up here. Dorsal to the soft palate. Yeah, so this is your nasopharynx. Let's see with the other half here. Yeah, this one's better. Okay, so torus linguae, fossa linguae, hard palate, soft palate, and your nasopharynx is up here. So what would this be underneath?
Oropharynx.
Oropharynx. Okay. Do you guys know what this is right here? Yeah. This is the medial retropharyngeal lymph node. This is really nice on this specimen, so it's definitely something he could tag. What is the main lymph node that drains the head in the ruminant?
Lateral.
Lateral retropharyngeal lymph node, which is right here. I don't know if you guys can see it. I can feel it. You guys see that? So that's your lateral retropharyngeal lymph node. So that's going to be directly ventral to your atlas. So again, wear gloves to your lab exam and feel everything. Some of the stations will say do not touch, but other than that, you can pick up things and look at things, so definitely do that. Okay, let's see. Okay, so what would this be right here? Yeah, so this is your dorsal nasal concha. What would this be called if he tagged it on a skull? Yeah, so a concha or concave is like the bone plus the mucosa surrounding it. So it's called a concha in the live animal. The bone itself is a turbinate. So I believe he made that distinction with us, like turbinates versus concha. If he tags it on the skull, it's a turbinate. If it's on here, it's a concha. Okay? So what would this one be?
The ventral nasal.
So your ventral nasal concha, and then your spaces. What would this one up here be? Yeah, so this would be your dorsal nasal meatus. What about this one? Middle nasal meatus. And then what would this one be? Ventral nasal meatus. If you were passing a nasogastric tube, which meatus do you use?
Ventral.
Ventral nasal meatus. And that's especially important to know in horses for later on. That was the main stuff for that. Yes. Yeah. Oh yeah, good call. Okay, so what is this right here?
Frontal sinus.
Yeah, so this would be your frontal sinus. He tagged this blood vessel for us on the lab exam. What is it? Yeah, so this is an artery, because it's red. So transverse facial artery. What would this nerve be right here?
Ventral.
Yeah, which part?
Ventral.
Yeah, so this would be the dorsal buccal branch of the facial nerve, right here. Okay. Do you guys know what this is right here? this structure.
That's a ventral buccal branch of the facial nerve.
Close. I'll give you a hint. Okay, so what's this structure right here?
Masseter.
Parotid salivary gland. This thing is leading directly into it. So what is that? Yeah, so this is your parotid salivary gland duct. Okay? It's right here.
Did you sign the sign sheet?
On the exam, do you want us to write all of those words out, or is it now just parotid duct?
I would write it all out. Just be as specific as you can. I don't think you would take all points, but just in case. Okay. What is this structure right here? It's kind of hard to tell when you can't feel it, but... So this would be your lingual facial vein. It's thin-walled. Sorry?
Is he going to tag veins?
He's tagged veins before, yeah. But it wouldn't be necessarily on this one. It would be pretty obvious. Everything he tags is very obvious. He's not trying to trick you. And that's, what's this muscle right here? Masseter muscle. And again, how would you tell if this was a sheep versus a goat based on the head?
For orbital sinus.
Yeah. So this guy, it's kind of hard to tell because everything's cut off. I think it's a sheep. So infraorbital sinus. What are the other two sinuses that only sheep have?
Inguinal.
That's right. Inguinal and interdigital. Yeah, we did that.
You just did them? Right.
Okay, so that's the head. How do you guys feel about that?
Better.
What was that
Cool.
artery that you pointed out?
The transverse facial.
Oh, okay.
Yeah.
So if he was gonna give us something and say which is this, a sheep or a goat, he would probably give us the infraorbital sinus.
Yes, but it's, I don't know, for me it was kind of hard to tell because a lot of the heads are removed now, so I would just say small ruminant. That's what I did on my midterm. I was like, I said whatever the structure was, and then I was like small ruminant, and that was fine. He didn't take off points for that.
He wants
Yeah.
you to say what species.
Yes.
Oh.
He
Wait,
didn't
every
specifically
question?
say that to us, but that's what upper termers told us, so we just write the species whenever you can, be as specific as possible. So left versus right, artery, nerve, vein, muscle. Don't just say transverse facial. You'd be like, okay, half points, because it's an artery. And you could probably say right transverse facial artery. Just be as specific as you can. He's not mean, but he will take off points for stuff like that.
And is he fine if we like abbreviate like A?
Yeah, you can put A dot, V dot, V dot, N dot, whatever.
I have a question. Is there a good way of differentiating between the nerve and the vein since it's not dyed? Is there like a or something?
It's just like the feel. And you can have to put gloves on. The vein is just this super like thin-walled, almost membrane feeling thing, and the nerve is like much more solid.
And veins have a lumen, so usually you could kind of like move them around, and the nerves are going to be solid in the middle.
You guys go with that? That was the main stuff that he focused on for us. Okay.
Did you guys have equal numbers?
Just the first part. What have you guys done so far? Nothing.
Nothing.
We didn't get our donkeys in the terms.
I'm pretty
may
sure
not.
it was like there was the neck, but there's two questions in the neck. Yeah, we had it in my game, but it was like really obvious stuff. But if you guys haven't done it, then you won't put it on there, so you're fine. Okay, so for the leg, it's just again main species differences and stuff that you should remember from Anatomy 1 if he tags it, because it's pretty similar. So we'll just go through a general overview. Okay, so what is this right here? Yeah, so cartilage of the scapula or scapular cartilage. This is unique to ruminants. And the horse, I think? Yeah, so only ruminants and horses have this scapular cartilage. Okay, so what is this muscle right here? Supraspinatus muscle. Okay. What this one right here? Infraspinatus muscle, and what nerve innervates these two muscles? Suprascapular nerve. Okay. what would this muscle be right here? This tiny thin one. Yeah, so this is your tensor fascia antebrachii. I don't know if you guys remember what it looked like in the dog. It was kind of just like a really thin muscle. It's more like chunky in the ruminants. That's the best way to describe it. It's still thin, it's still in the same part, but it doesn't feel or look the same way. So this is your tensor fascia antebrachii muscle. So then what would this muscle be right here? Yeah, so this is the long head of the triceps. So what would this one be? Lateral head of the triceps muscle. Okay.
Could we say triceps muscle, or would we have to say like triceps brachii?
You're right, that's a good point. Triceps brachii muscle. Yeah, be as specific as possible. Okay, so what would this muscle be right here?
Biceps brachii.
Yeah, so this is your biceps brachii muscle. Do you guys know, okay, so ruminants and the horse have a fibrous band that connects the biceps brachii to the extensor carpi radialis. Have you guys gone through that yet?
Mm-mm.
Okay, so I guess we won't do that. Okay, I'll tell you that later when you guys do it.
Yeah, Lacertus fibrosis.
So it's called a Lacertus fibrosis. You can't see it properly on this specimen, but he tagged it on our midterm, but that was because we had done the limbs, so he won't focus on that for you. Basically what it does is that it allows them to stand in extension for a longer period of time because it has this extra fibrous band that allows them to use less energy. So it's an energy saving thing.
Where does it connect?
It connects the biceps brachii to the extensor carpi radialis, and he loves it. So you'll see it eventually.
What's the name of it again?
Lacertus, so Lacertus, fibrosis, fibrosus. Okay, so what would this nerve be right here? This one's kind of tricky. What's this muscle?
It's the thoracic latissimus dorsi.
Close, yeah. So this is your latissimus dorsi muscle. So what's this nerve that innervates it? Thoracodorsal, I thought. Lateral thoracic innervates, what was that again? Your cutaneous head.
True.
Yeah. So latissimus dorsi, thoracodorsal nerve. Okay. If he put a string around this entire structure right here, well, okay, let's see, how can I do this better? This. What would you guys call this? So there's just this part right here. It has a string around it. Median.
Nerve.
Yes. So this is both. This is what he did to us in our midterm. So he tagged this, and this is your median and musculocutaneous nerve. Because at this point, they're still running together, and then they separate later on. You can see where they separate right here. You guys can see that properly. See? It separates right here.
You guys might need to look at it up close, but you can sort of see it. If you look, I mean, if you're wearing gloves and you look closely, you can tell, so just double check these things.
So keep that in mind. He can tag both of them, or he can tag one or the other. Okay? So what is your musculocutaneous nerve innervate? Yeah. So your musculocutaneous nerve innervates your biceps brachii, brachialis, and coracobrachialis. Okay?
Okay. So what would this nerve right here be? Yeah, that's your ulnar. So right here, all three of those nerves are connected. Okay, so just check where he's tagging it. So what did we say it's going to be called if he tags it right here? Median and musculocutaneous, and then right here? Yep.
What is this right here?
Lymph
Yeah.
node.
So this is your axillary lymph node. He loves lymph nodes. Like wherever they're present in the body, you should probably know what they are.
Where was the lymph node?
There. Okay, so what would this nerve be right here?
Axillary.
Would that be axillary? That was radial. Am I making shit up?
No, I think that's radial.
Yeah, so that's your radial nerve because it's diving deep to innervate these extensor muscles.
I thought the radial nerve was the big one.
There, isn't
And
it?
then the axillary should dive down and go all the way through. There's a radial goes through
I think that's,
That's radial.
yeah. I think that is our biggest nerve right here.
Because these guys, you can kind of well trace them to where they go. That's the only one that's left over. So that's your radial nerve on this specimen.
This guy right here.
Don't get too bogged down in these details. Like he loves median and musculocutaneous. He loves tying those two together. It'll probably just be like one nerve from the brachial plexus, one or two, to just refresh your memory on this stuff. Okay, let's see. Okay, so if he tagged this right here, what would it be? So this is your axillary artery. So what would this one be? Yeah, so this is your brachial artery. So coming down here, the brachial artery gives off a branch. What is that branch called?
Interosseous.
Yes. You can kind of see it, but not really. So it gives off the common interosseous branch, and then what is it called past that point? So what would this artery be called right here? Median artery. Right. Yeah, I don't think we can with that, this guy. So again, keep in mind that when you guys get to the course, you guys have to know every single ligament, every artery, every nerve, every vein, everything. So just keep that in mind when you're learning that section to like keep up with the material. Okay? What is this muscle right here?
Oh wait, no, extensor carpi. Sorry, I thought you.
It's okay. So this is your extensor carpi radialis muscle. Okay? So what is this one? Common digital extensor. And you can follow it and see it gives off branches to all of the digits. So this is your common digital extensor. What is the one lateral to that? Lateral digital extensor. Yep. And then what's this guy right here? Ulnaris lateralis. And do you guys remember the two heads of the ulnaris lateralis? Did he go through that with you? So this is the humeral head, the large one, and this is the ulnar head, which is this tiny, tiny little muscle at the back.
Do you think that he's gonna tag some of this stuff that he didn't teach us?
He would.
Because he did it, when he did it with us, he did it with some groups and not all. And I don't remember exactly which muscles he tagged, so I just want to be safe.
Yeah. I was just
Wondering
wondering.
that little
Yeah, it's hard to tell because we
This
did
one?
learn this
Yeah.
before. So.
Yeah.
What was it?
This is part of the deep digital flexor.
Yeah,
That's
that's
what
what
the
Dr.
first
Neo
said.
told me.
This, this is part of the deep digital
That one
flexor.
is.
This right here
Yeah.
is part of the deep digital flexor, right?
Yeah.
Yeah. So there's this that's underneath of
No,
this.
she said like the whole like thing, so like the muscle and like the tendon that goes all the way down.
That's what he
So-
told us too, and Ari told us what you guys were saying.
Okay.
Ari and Freddie said
Okay.
So we understand that this is ulnaris lateralis, and then if you move that aside, you see this tendon that's deep to that. That's part of the deep digital flexor. Yeah. And then you have superficial digital flexor, and then the rest of the deep digital flexor. Yes, but you have to move ulnaris lateralis to see that.
So something he likes to do later on, but it's exactly the same, and it's something you guys should know from Anatomy 1. He will put like a string around this entire group of muscles right here, and he'll be like, what group of muscles is this? So what would you guys say? Extensors of what?
The forelimb.
specifically. So this is your extensors of carpus and digits. Okay? And I'll tell you why when we get to the hind limb, why you have to say this. So this is your extensors of your carpus and digits, and what is the main nerve that innervates this group of muscles?
Radial nerve.
The radial nerve. Okay? If he puts a string around here, what group of muscles is this?
Flexors of the carpus and digits.
Flexors of the carpus and digits. And what are the nerves or nerve that innervates this group of muscle? Median and ulnar. He likes that question. When you get to the donkey, it's pretty much a guaranteed question on the final, probably. Okay. So how do you guys feel about that?
Better.
Okay. It's just a lot of stuff that you guys need to refresh on because it's pretty much exactly the same as Anatomy 1. Okay.
You guys might want to ask him how much you're responsible for knowing with the limbs.